Today we're tackling one of the most clinically misunderstood concepts in veterinary microbiology, the difference between normal flora and opportunistic pathogens. This distinction matters because it changes how you read a culture report. Every day, healthy animals carry huge, diverse microbial communities on the skin, in the ears, the mouth, the gut, the urogenital tract, and a lab will happily grow those organisms whether or not they are causing disease. If you treat every positive culture as an infection, you will overdiagnose, overprescribe antibiotics, and drive resistance. Over the next few minutes, I'll give you a framework, what normal flora are, why they're beneficial, what turns a harmless commensal into an opportunist, and the high-yield organisms where this trips people up. The single take-home message is this: context is everything. Keep asking. Right organism, right site, right host, right amount? Flora, increasingly called the microbiota, are the microbes that live on and inside healthy animals. The first thing to fix in your mind is that they are not random contaminants. Each host species has its own characteristic flora, and within an animal, each body site supports a distinct microbial community. The bacteria thriving on the skin are different from those in the colon, the mouth, or the vagina. So when you read a culture, you must know what normally lives at that site before you can judge whether a result is meaningful. Second, this is a dynamic ecosystem, not a static list. The community shifts with age, diet, season, hormones, and especially antibiotic exposure. It is in constant dialogue with the host immune system and epithelium. Holding those two ideas, species-specific and site-specific, living and changing, is what lets you interpret microbiology in context rather than treating every organism as a pathogen. Are not passengers. They are active contributors to health, and there are 4 benefits worth memorizing. First, colonization resistance. By physically occupying the skin and mucosal surfaces, commensals leave no open real estate for pathogens to attach and establish. Second, immune training. Early exposure to commensals educates the immune system, calibrating tolerance and the inflammatory response so the animal neither overreacts nor underreacts later in life. Third, nutrient production. Gut flora ferment fiber into short-chain fatty acids that feed the colonic epithelium, and they synthesize vitamins such as several B vitamins and vitamin K. Fourth, competitive exclusion. Commensals outcompete would-be invaders for nutrients and binding sites, and some actively secrete inhibitory compounds. This is exactly why broad-spectrum antibiotics can backfire. Wipe out the protective flora, and you remove colonization resistance, opening the door to overgrowth by organisms like Clostridioides or resistant coliforms. Healthy flora is a frontline defense. Opportunistic pathogen is normal flora that causes disease only when it gets an opportunity, hence the name. The organism itself hasn't changed into something exotic, the circumstances around it have. 3 conditions create that opportunity. First, host compromise. When immune defenses are weakened by illness, stress, corticosteroids, chemotherapy, or concurrent disease, organisms the body normally keeps in check can flourish. Second, location. A commensal that is harmless in its home turf becomes a pathogen when it reaches a sterile or vulnerable site. The classic example is gut E. coli ascending into the urinary tract, where it is the leading cause of urinary tract infection. Third, dose. Even in a healthy host, an overwhelming number of organisms, say contamination of a wound or a surgical site, can tip the balance. So the diagnostic question is never simply, is this organism present? It is this organism here, in this host, in this amount, in a context that explains disease? That reframing prevents a great deal of overtreatment. Actually flips a harmless commensal into a pathogen. 4 triggers, and most clinical cases involve more than one. First, barrier disruption. Skin and mucosa are physical walls, and anything that breaches them, a bite wound, a burn, surgery, an intravenous or urinary catheter, gives flora direct access to deeper tissue. Second, immunosuppression. Physiologic stress, corticosteroids, viral infection, endocrine disease like Cushing's or diabetes, and chemotherapy all lower the host's guard. Third, dysbiosis. This is where antibiotics come back to bite us. By killing the protective community, broad-spectrum drugs clear the way for overgrowth of whatever survives, often resistant organisms or yeast. Fourth, foreign bodies. Implants, sutures, and catheters provide an inert surface where microbes form biofilms that resist both immune clearance and antibiotics. Notice the clinical pattern. The sick, hospitalized, post-surgical, or recently antibiotic-treated patient is exactly the one in whom normal flora turned dangerous. Recognizing these risk factors lets you anticipate opportunistic infection before it happens. For organisms where this concept is tested constantly in exams and in practice, Staphylococcus pseudintermedius is normal flora on canine skin and mucosa, yet it is the single most common cause of canine pyoderma and bacterial otitis. The methicillin-resistant version, MRSIP, is a major and growing concern, which is why you don't reflexively treat every skin swab. E. coli lives quietly in the gut, but is the #1 cause of urinary tract infection, and it also drives mastitis and neonatal septicemia, a textbook case of right organism, wrong place. Pasteurella multocida is normal oral and respiratory flora in cats and dogs. Introduce it under the skin via a bite wound, and it causes rapidly spreading cellulitis and abscesses, and it's a classic cat bite zoonosis in people. Malassezia pachydermattis is a commensal yeast on skin and in ears that causes disease only when it overgrows, typically in allergic or moist skin. The lesson is identical across all four. Finding them on culture is expected. Disease requires the right context. Let's consolidate. 3 sentences are all you need to carry out of this module. First, flora does not equal infection. Simply growing an organism from a swab or sample is not proof of disease, because healthy animals are covered in cultivable microbes. Second, context determines pathogenicity. The same organism is a harmless commensal or a dangerous pathogen depending on the host immune status, the body site involved, and the dose. Third, clinical correlation is essential. You must read every culture result alongside the patient in front of you, the history, the clinical signs, the site sampled, and whether the organism and quantity actually explain what you're seeing. Do that and you'll interpret microbiology like a clinician rather than a lab printout. You'll avoid overdiagnosis, use antibiotics responsibly, and still catch the genuine opportunistic infections when they matter. Normal flora are essential to health, but under the right conditions, they turn opportunistic. Context is everything. If you found this helpful, please like and subscribe. Thanks, and I'll see you next time.